Hi, and welcome back to the Dr. Ramsey Show. I just returned from a full weekend with my teacher, learning all the studies, and I want to share that two of our new providers that start in July joined me. Next week, you have the pleasure of meeting them. Most of you already know Angela and Taylor, but they're going to share their highlights with you as well. So, when we go to these trainings, Dr. Rouzier reviews so many articles. In level 1, he reviews the positive articles. As we get more advanced, he reviews the negative articles as well, meaning they say it caused risk, but it didn't, or, those different types of negative studies. But level 1's all about getting practitioners ready to prescribe. And what I wrote to the girls last night, I texted them, I said, thank you for your courage and for practicing the truth in medicine. Because the truth is, as we age, we get sick. And the main reason is we lose our protection. Our protection is our hormones. Hormones dictate how our cells, how our glands communicate to each other and do the jobs they're supposed to do. And when we lose them with aging, life becomes harder, and we become sicker. So hormone replacement therapy both improves our quality of life and reduces the aging risks. So I just want to share a few, and these are very basic. I'm not going to share the whole article. I'm just going to read what was on the slide that Neal presented. And I'm going to just go through a little bit to give you a potpourri of what these hormones are known for in the research. Thousands of articles are available. So the first one, he's talking about visceral fat. Visceral fat is very risky for diabetes, heart disease, Alzheimer's, and cancer. So we want to keep our visceral fat low. And this article says, decrease in visceral fat. Is this considered to be anti-aging? And we don't like that word anti-aging. We like to use preventive aging because we're all going to age. We're not going to go against it. We're going to support it. Augmenting, meaning increasing, the lower levels of thyroid hormones that decrease with age may better control visceral fat. We just talked about that. Deposition, thereby leading to decreased insulin resistance and to decreased risk of diabetes and atherosclerosis. So insulin resistance is this, and this exists for all the hormones. So if these are receptors, right, the hormones have to lock into receptors to have a change in our DNA. And so we have insulin and we have the receptor, but it's not able to communicate. It's not able to metabolize sugar. That happens to a lot of us for different reasons: toxicity, drug use, chronic medication use, where the receptors just aren't receiving. And that's where we often have to give higher levels to get a response. And that's what he's talking about with thyroid. There were so many articles on thyroid that my patients do have very high levels of T3 and T4, which are the metabolic hormones, and very low levels of TSH, which goes against conventional medicine. If a conventional doctor sees this, and they do, they think there's something wrong with the patient. But thyrotoxicosis means you have a high heart rate, you're sweating, your eyes are buggy. That's thyrotoxicosis. My patients have a heart rate of 60. They're very calm and relaxed, but they have really good numbers for metabolic health, especially for brain health, weight. Thyroid can reduce dry skin, constipation, poor thinking, etc. So that there was a lot on thyroid. Now I want to share a little blurb on, this is thyroid too. Let me go here. It's called mild thyroid disease may raise cardiac risks. So that means normal thyroid can leave you at risk for heart disease as you age. Subclinical hypothyroid, which is what my patients have. I show them the normal range in conventional medicine and where I want them, which is optimal. Subclinical hypothyroid is linked with more than a twofold increase in heart attack risk among women aged 50 and older, according to a recent study from the Netherlands. Mild thyroid disease is in the same ballpark as well-established cardiac risk factors like high cholesterol and smoking. So if you don't smoke because you want to protect your heart, then we should take thyroid because that protects your heart. Low levels are just like smoking. Low levels are just like having high cholesterol. Low levels are normal levels, and that's what my patients understand. This little blurb is on testosterone. Late onset male hypogonadism, low secretion of testosterone from the testes, and testosterone replacement therapy in primary care. Of 18 prospective studies involving 3,866 men with prostate cancer and 6,438 controlled subjects. The researchers found no association between the risk of prostate cancer and high serum levels of testosterone and several other related hormones, with the exception of an inverse relationship to sex hormone binding globulin, right? So everything improved and the sex hormone binding globulin went up. A lot of doctors think that's risky. SHBG, or sex hormone binding globulin, is a metabolic protein. The higher this protein, the lower our risk for diabetes, heart disease, Alzheimer's, and cancer. What we have to do, because it binds up the testosterone, is just raise testosterone. So it's interesting because my patients have very high levels. Other doctors simply don't like that. So now I'm going to read just a little thing, because there is this belief that giving testosterone to men increases the risk of prostate cancer. There is not one randomized clinical trial that says that. What I'm going to read to you comes from the one man that said testosterone causes blood clots, and now that's on the PDR, the physician's declaration of testosterone, that testosterone increases the risk of blood clots. And I just have this little, it's actually the summary of his article that I'm reading to you right now. Of the 14 patients, 13 were Caucasian and 1 was African American. Of the 14 patients, 13, or 93% of them, were found to have a thrombophilia, which means a genetic disorder that causes blood clots. So if they all had this disorder and 1 didn't get a blood clot, it doesn't make any sense. Now I want to tell you what this was. Dr. Glueck read over an insurance data review of who received testosterone prescriptions. Doesn't mean they took them, doesn't mean they filled them, but prescriptions were written. And he's writing about these patients who got a prescription and had a blood clot, and they already have a predisposition to have a blood clot. It was not caused by the testosterone. If it was, we would have seen it in a randomized controlled trial to date, and we just haven't. So testosterone doesn't cause blood clots. High levels of thyroid are not risky, but low levels are. And testosterone increases protection against prostate as we age, does not increase prostate cancer risks. So that's just a few things he reviewed this weekend. Next week, Angela and Taylor are going to share with you their highlights that they took away from meeting Neal for the very first time. Thank you so much for listening. We'll be back next week with the girls.